So today we can study CPT anesthesia guideline for CPC exam and how to code. Okay, so today we can study CPT anesthesia, how to code the anesthesia CPT with examples. So the first question, a 10-month-old child is taken to the operating room for removal of a laryngeal mass. What are the appropriate anesthesia codes? So here, what is the information we get from the question? It is a 10-month-old child and removal of the laryngeal mass. So here we have two main codes, 00320 and 326. So one we can see age 1 year or older, other is younger than 1 year. So here this is a 10-month-old child. So the more appropriate one is 00326. At 00326, the option B and D, the D has 99100. So we already studied in anesthesia some physical status modifiers as well as some 99 modifiers. So among them, the 99100 is related with the age. But here, there is a parenthesis saying we should not report 00326 with 99100. So option D is the wrong one. So our answer is option B. Now next, a patient is having knee replacement surgery. The surgeon requests that in addition to the general anesthesia for the procedure, that the anesthesiologist also insert a lumbar epidural for continuous infusion for post-operative pain management. Anesthesiologists perform the post-operative management for 2 post-operative days and select the appropriate procedure code for the anesthesiologist. So what are the information we get? Knee replacement surgery, lumbar epidural, post-op pain management for 2 days. And here, we have two options, 1400 and 1402. And 1400 is for open or surgical arthroscopic procedure on knee joint, and 402 is total knee arthroplasty. A code is selected for the general anesthesia performed for the total knee replacement. So here this is a total knee replacement. So what is the code? The more apt code is 0402. So the term knee replacement, that is a total knee replacement, is done. So the apt one is 01402. So we have the option B and C. The another difference is 62327 or 62326. So if we check, 62326 is without imaging, 62327 is with imaging guidance. But they have not mentioned any imaging guidance. So we are not reporting 62327. So the more apt is option C. Okay. So, and report 0919964 for daily hospital management. So we have 2. That's why we are reporting into 2. So the answer is option C. Now, here the question is about the anesthesia time. Pre-operative diagnosis, multivessel coronary artery disease, and post-operative diagnosis is multivessel coronary artery disease. Name of procedure, coronary artery bypass, graft into 3, left internal mammary artery to the lag, and saphenous vein graft to the obtuse marginal, saphenous vein graft to the diagonal. The patient is placed on heart and lung bypass during the procedure, and the anesthesia time is 6 to 12, whereas surgical time is 6:15 p.m. to 11:30 p.m. And what is the question? Question is anesthesia code and anesthesia time. So we know what is the anesthesia time. Anesthesia time is the time when the anesthesiologist is looking after the patient, and that is 6 to 12. So 6 hours. Here we have 2 time. One is surgical time, another is anesthesia time. But the question is about the anesthesia time. So we are going with the option 6 hours. Okay, so we have to remove option C and D. And what is the difference between 567 and 566? 566 without pump oxygenator, 7 is pump oxygenator. The patient is placed on the heart-lung bypass during the procedure. So we have to take as the pump oxygenator code. So the answer is option A. Now, a 42-year-old with renal pelvis cancer, received general anesthesia for a laparoscopic radical nephrectomy. Patient has controlled type 2 diabetes, otherwise no other comorbidity. So here CPT ICD 10 CM code for anesthesia is asked. So renal pelvis cancer is the general anesthesia is done, laparoscopic radical nephrectomy and type 2 diabetes. So here 008606. So if we check, renal pelvis cancer is C65.9. So we are taking the option only with the renal pelvis cancer. So we remove option E and D. Now next is this modifiers, and here we have the patient is having only controlled type 2 diabetes. So that is a mild systemic disease. So we can take the modifiers P2. So we remove the other option. So the answer is option C. Now if we go through 00862 as renal procedure, P2 we already discussed. C65.9 is renal pelvis cancer and type 2 diabetes is 11.9. Answer is option C. Now, a healthy 32-year-old with a closed distal radius fracture received monitored anesthesia care for an ORIF, that is open reduction internal fixation of the distal radius. What is the code for the anesthesia service? So, what is the information we have? This is a closed procedure, closed distal fracture, but the procedure is an open one. And what are the modifier we have to use? This is a normal healthy patient. Healthy is mentioned. So that is a normal healthy patient. Closed distal radius fracture. Monitored anesthesia care. For that we have to report GS. There is no reference of the cardiopulmonary condition. So no G9. So firstly we can remove the option D. And what is the difference between 30 and 860? One is open surgery and another is anesthesia for forearm, wrist or hand, cast application, removal of repair. See here, this is an open procedure. So 1830 is the more apt. What is the difference between A and C? That is a QS, and QS should be there because there is a monitored anesthesia care. So our answer is option C. A 6-month-old patient is administered general anesthesia to repair a cleft palate. What anesthesia code are reported for this procedure? So, this is a 6-month-old patient. That means we should use 99100 as the patient is of extreme age, 6-month age. So, we removed the option B and D. So, before removing, we should also go through the 99100, whether we should report or not. And here 7072, repair of the cleft palate is 72. So the answer is option C. A 50-year-old female had a left subcutaneous mastectomy for cancer. She now returned for reconstruction, which is done with a single drum flap. Right mastopexy is done for asymmetry. So here 4042600. And this is reconstruction procedure and with a flap. So reconstructive and with tram or any flap, we have only one code here, that is 00402. A very large lipoma is removed from the chest measuring 8 square centimeter and the defect is 12.2 centimeter, require a layered closure with extensive undermining. MAC is performed by a medically directed, certified, registered nurse anesthetist at CRNA. So for the CRNA service with medical direction, there is a monitored anesthesia care QS and with the medical direction by a physician, medically directed. So we have to report two modifier, that is a QS and QX. So we have two options A and D. So what is the difference between 300 and 400? 300 is posterior trunk, 400 is anterior trunk. And here this is a chest area. Lipoma is removed from the chest. So that means anterior trunk. So 400 is the more apt. So option A. 48-year-old patient was undergoing anesthesia in an ASC, that is an ambulatory center, and began having complication prior to the administration of anesthesia. Surgeon immediately discontinued the planned surgery. So here, the planned surgery is discontinued before the anesthesia administration. So that's why we are reporting the modifier 73 here. No, anesthesia time is reported as 6:14 a.m. and surgery began 6:26 a.m. Surgery finished at 7:18 and the patient was turned over to the PACU at 7:29. So what is the time? It is 6:14 to 7:29 and that is 75 minutes. An infant 11 months present for an inguinal hernia repair and the procedure was performed under endotracheal general anesthesia. Report the anesthesia code or service. So this is an extreme age 99100 and we have to go through 832, 834, 830. And 832 for hernia repair in the infant 1 year or age younger 00834 and 836. So we have to remove the option C and D. And why we removed A? Because in 834 it is written we should not report 00834 in conjunction with 99100. So whenever you have this like codes with the options with 99100, we have to check whether any parenthesis is written we should report or not. So answer is option B. What is the correct anesthesia code for an OB patient who had a planned general anesthesia for cesarean hysterectomy? So this is a planned 001969 is an add-on code. For CS hysterectomy 00196, they have not mentioned any planning. Urgent is 001962. So that is not a planned one. 1962 is an urgent one. Planned vaginal delivery 01967. So even though the term is not there planned in 0091963, all others are different cases. So we are reporting 001963. A patient present for a shoulder arthroscopy which began and became an open procedure of the shoulder joint. So open procedure. So 001680 is for cast. 6222 is a diagnostic arthroscopy. As it's an open procedure, we have surgical procedure. And 1630 is open surgery. 638 is total shoulder replacement. So they have mentioned only open surgery. So the opt one is 01630. That is option C. 62-year-old patient is having surgery on the pericardial sac without use of pump oxygenator. So the patient is 62-year-old pericardial sac without use of pump oxygenator. So here they have mentioned anesthesiologist case. That's why we are removing the option B with 36620. It is surgical procedure. And 0561, 562, 560, 561 and 62 are with pump oxygenator. But here it is clearly mentioned without. So the answer is option D. A patient present to the OR for a craniectomy with evacuation of a hematoma. So again, we are removing the option A and C. Why? That are surgical procedure. Here, this is an anesthesiologist question. 210211. It is craniectomy for evacuation of hematoma. That is a direct question. So answer option B. A healthy 79-year-old patient with communicating hydrocephalus undergoes creation of a ventricular peritoneal shunt. So here, this is an extremely aged 99100 and modifier P1, the patient is a healthy one. Now, what is the difference between 210 and 220? Anesthesia for intracranial procedure, and if it is CS, that is CS, cerebrospinal fluid, CSF, we have to report 0220. Okay, so the answer is option A. Patient receiving radiation therapy for a brain tumor require anesthesia. So for the radiation therapy 01922, radiological procedure are 2430, intracranial 33. So the answer is option A. Thank you for watching this video. Please like, share, subscribe for more updates.